primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story Podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Maryal Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Well, welcome everybody. I am so excited to be joined by Justin Lam again on the podcast. We are going to be talking about a super hot topic that we are going to be buzzing about at the upcoming DPC Summit, where you'll get to meet Justin and you'll get to meet one of the VAs that we'll be talking about today. So Cool Blue VA is an amazing company. They have been so supportive of the DPC movement, and they have been working continuously to improve how they are pairing virtual assistants, medical virtual assistants, with DPC physicians to help DPC practices thrive. So Justin, thank you so much for joining us today.
Yeah, thanks for having me, Doctor. So happy to be here. We had a great conversation last time, so I was super excited to come back. I just love the DPC community. I've been to a lot of DPC conventions now, and so I just wanted to continue to support this vibrant community and this movement, really.
Absolutely. And if you have not listened to the episode where Justin and his sister, Dr. Carrie Lam, came onto the podcast, please make sure you check out the link in the blog accompanying this podcast, because it's so important to not only recognize Cool Blue VA's work in helping the DPC movement, but also recognizing that from the story that they talked about before, they stand by their word because they use medical VAs all the time in Dr. Lam's practice, and their family is also using medical virtual assistants because they have quite the medical community amongst the Lam family. So this is coming from not only passion to help the community, but experience. And that's why I want to make sure that if you haven't listened to their previous conversation, take a listen to that. But today we're going to be talking about the two big questions when it comes to hiring a virtual assistant in the DPC space. And those two questions are, well, how do I know the time is right to hire a VA? And then the second set of questions is going to be revolving around how to actually hire the VA once you recognize that pretty much everybody needs a VA. So so with that, let's get started on today's webinar. Everything you need to know about hiring and how you can find great help for a fraction of the cost. So Justin, take us away.
Yeah, absolutely, Dr. Maryal. And the things I'm going to be talking about do pertain to a virtual assistant to a VA. But really, what do you learn from this? You can really take and apply to anything, really, for any hiring practice as well. I've talked to a lot of HR people. I've hired and fired thousands upon thousands of people now. So these are all things that I've learned throughout the years to really fine tune and to give you guys really these gems here. And if you guys are just listening, there are slides, but we'll talk you through it and whatnot, so it should be all right. Once again, I'm Justin Lam. I was the COO and CMO of Dr. Lam Coaching, and then as Dr. Maryal mentioned, I was also the CEO of Lam Clinic, along with my sister, Dr. Carrie, and Dr. Jeremy Lam. And that's when we started utilizing virtual assistants. Really blew up the clinic. So then I came out and founded Cool Blue VA, which I'm the CEO and founder of that. But really, the core issue that what we're talking about, Dr. Maryal, right, is when and how do you know when to hire a VA? And really the core of that is, what is the most valuable asset in your practice? Or if you haven't opened a practice yet, what do you think is the most valuable asset in your practice here? And really the answer to that is that it's you, the doctor, all right? Because there's only one doctor in the practice, in direct primary care. Let's say hire somebody else. But when you first open it up, really there's only you. And so your time, you're the only doctor in the practice. You only have 8 hours in a day, right, where you can see patients. And that's really a rate limiting step, right? That's what is limiting how fast you can grow, really, is your time to do that. And the second thing is your knowledge, right? You're the only person in your practice who went to school to be a doctor, and nobody else has that knowledge that they can pass on to their patients, right? So these two assets, they have to be protected at all costs, right? Because like I said, they're the rate limiting step for you and how fast your practice can grow and how fast you guys can scale. And it's unfortunate nowadays, we're finding that more and more doctors are spending a lot of time on paperwork. There's been a couple of studies done that over the years, people are spending 11 to 22% more time on documentation, on their EHR. On average, people are spending 2 hours of clerical work for each hour they're spending face to face with their patients, right? So that's really unfortunate. That's a lot of your time that's spending that you could be seeing patients, generating revenue, taking care of people, using your doctoring skills, which are actually just spending on admin work, busy work, whatnot, not seeing patients.
These data points are so relatable to probably everybody out there who has gone through residency, who has gone through a corporate practice, because when we think about, even with the advent of AI, with the advent of how many more back office people can we hire or can the corporation hire, it's still so ridiculous how much pajama time is spent on charting. And so I go back to my comment and my joke about who needs a VA, probably everybody. And I love, though, that you clarified it. These skills could be used for a person who's in person or a virtual assistant. But when it comes to your time that you are spending and not getting paid for typically, this is where in DPC it matters more, because your time is definitely related more so to your overhead than in an employed role. So I really love that you highlighted the ugly reality of pajama
Mhm.
time work that, again, most of us never got paid for. So the thing I love about this conversation, where it's different than the last conversation with Dr. Carrie Lam, is that we're going to get a little interactive here. So if you are driving, if you are mowing your lawn, definitely take a listen, but keep in mind that you can press pause and you can rewind, and you can press pause when you're in a place where you can brainstorm and write things down. But Justin's going to help us go through the time and task audit first, because if you are a person out there who is saying, I don't think I need a VA, though I think I can manage my time pretty well, this time and task audit is pretty slick at actually breaking down in black and white what you are doing with your time. So Justin, tell us about this first exercise.
Just a little spoiler alert, if you guys really don't want to do any of these exercises, there'll be something at the end of the podcast here that will really give you the shortcut on how to do all this and how we can take care of all of this for you here. But the first exercise, Dr. Maryal, like you mentioned, is a time and task audit. Really, what you want to do is write down on a piece of paper the top 5 tasks that you do and what they are and how much time you spend on them a week here. And it could be anything, like Dr. You say pajama time, like charting, if you're answering patient emails or phone calls, right? Or if you're busy ordering labs, or if it's like social media and you're just on social media, like posting and creating content. It could be anything that you're taking your time on. And we want to really list it down. Number 1, number 2, number 3, number 4, number 5. I'm sure there's 100 things that you could list down, right? But just start with the top 5 that you really spend the most time on, and take your time and do that. Once you have those 5, and you can pause this at any time and see, but once you have those listed down, then you really want to circle the tasks that you can delegate to a virtual assistant. And realistically, when you're thinking about that, is anything that you're doing on a computer that can be delegated out. The only thing that can't be delegated out is if you're seeing a patient in person. Those are the things that you cannot delegate out. But anything that's on a PC, on a laptop, on your phone, on your computer, you can pretty much delegate that out to a virtual assistant or to a person. All right, so circle those tasks and keep those in mind, because we'll be coming back to them in a little bit here. And just to bring the point home again, here's some other data points that we had. Physicians are spending 20% of their time in direct clinical face-to-face time with patients only, and about almost 50% of the time, 49% to be exact, doing EHR and desk work. And even when they're in the patient room, 52% of the time is just interacting with the patient, and 37% of the time they're still on a computer typing in and doing desk work in the room with the patient right there, right? So that's the unfortunate reality that we live in right now. And that's all stuff that's on a computer that you could hand off to somebody to really help you out.
And I will say here that if you're listening out there and you're like, but I haven't yet started my DPC, or my DPC is literally a week old and I have 0 to 10 patients, and you're like, I don't even know what my tasks are. What I would say is that you have an entire community of people who have practices similar to yours, in terms of you might have a practice next door or an hour and a half away that has somebody else who is a breadwinner in their family, or is a parent, or is a caregiver. And you can talk to these people, because we are all physician entrepreneurs and we have all been there. We have all been there on day one. So when it comes to, if you don't necessarily know what your top 5 tasks are, one, realize that you can ask other people to get ideas of what their tasks are. And two, your top 5 can always change. So this is a nimble conversation. You can come back to it in a month after you open your DPC, in 2 years after you open your DPC and you're ready to hire another staff person. So Justin, here, let's keep going in terms of why a doctor comes to you to start asking, Cool Blue VA, can you please help me with answering the question, do I need to hire a virtual assistant?
Yeah, absolutely. And just to add on to a little bit what you said, if you don't have top 5 things that are taking the most amount of time, you could just write down the top 5 things that you hate doing. And those are things that you can hand off as well, right? The things you just dread doing on a daily basis. Yeah.
Great advice.
Yeah, but moving on to why you need to hire. Really, the first thing is to extend your capability, right? So you can only see so many patients or return so many calls in a day. Like I said, your time is a valuable asset. So in order to extend that capability, you need support staff to help you, right? Help you call patients, help you return emails, help you book appointments. All that stuff is time that you could be seeing a patient, generating income, taking care of people. So really extending your capabilities is huge. Protecting your time, like I said, anything that a doctor is to do should be really only things that a doctor can do. So you can really focus on your strengths, right? That's huge. Third thing, really enhance the patient experience. DPC medical practice, we don't really think about it, but it is a service industry. Really, we're all about customer service. We're all about patient satisfaction. And so you want to make sure that the patients that you're seeing have a great experience, because then they're going to keep coming back to you, right? So timely follow-ups, fast response times to emails, to texts, smooth processes. This all improves the patient satisfaction. That all makes the patient want to come back and see, because that's super important in the service industry, in the medical industry. And then increase revenue potential, right? You want to spend more time on revenue generating activities. You want to spend less time on paperwork here. So anything that's going to generate revenue, you should be doing, or you should be hiring somebody to do. And anything that's just more administrative, busy work, grunt work. I don't like to say that, but somebody has to do it, right? A doctor, let's say, makes like $150 an hour. Like, you don't need to pay yourself $150 an hour to do something that costs $10 an hour to do, right? That's just not efficient. So you should be doing stuff that generates the revenue.
Mm-hmm.
And to reduce burnout. I'm sure a lot of DPC doctors have already experienced this. That's why they left working at hospitals, working at corporations and whatnot, because they want to have that work-life balance. They want to use their medical degree to help the community out, help patients out, and really do what they went to medical school for. And then you guys didn't go to medical school to do paperwork, right? To learn how to market, right? That's not really what you went to medical school for. So find people, hire people that are going to be great at doing that for you, so you can once again focus on doing what you love, what you're passionate about, and then that's going to reduce burnout. Now you know why you want to hire people. So when is the right time to hire? As Dr. Maryal mentioned, there's runs a gamut of DPC doctors, people who have been established for a long time, people who are just starting out, people who are just thinking about starting out. So when is the right time to hire? And the first thing is, there's a lot of skills. that you need as a business owner. You need to have sales skills. You need to have customer service, legal, accounting, medical, admin, marketing, IT, website design, right? Operations, human resources. This is naming a few skills here. So chances are you're probably already hiring somebody to do some of this stuff, and some of the stuff that you're taking on, which you may just be kind of figuring out how to do on the fly or something. Hire somebody who has the skills really to make life easy for yourself.
But I think this is so important to recognize. Like when you're a physician entrepreneur and you may be joining a clinic that's already open, but still, these are the things that are involved in a service business, like you said. And so it's really important to recognize that not only are these skills going to be in a service business, to what extent that's going to be determined by the type of practice you're in, but when it comes to figuring out where your skills are strong and where your skills can be helped by other people who have stronger skills in these areas that you talked about. Justin's going to be walking us through our second exercise. So get ready. We're going to have our second exercise focusing on where are your skills and where is the gap between the skills that you have and the person who can help out with their training and their expertise.
And that's where the skills gap exercise comes in. So, what you really want to do for this next exercise is list the skills that you currently have as a business owner. For example, you're great at being a doctor. If you worked in the hospital, you learned how to take care of patients, you have great customer service and whatnot. Or you have a friend or your spouse or significant other who has a background in legal or something or accounting. Those are skills that you kind of have here. So list the skills that you have. Those are skills that you don't need to hire for, right? So you're pretty confident and comfortable in those skills. On the opposite side of that is skills that you don't have. Like I said, everybody went to school to be a doctor. Not everybody went to school to be a business owner, an entrepreneur, right? So there's skills that people lack. So list down all the skills that you feel like you need help with, that could be improved on, that you're not quite sure on what to do with in those areas here. And those are really going to be the skills that you need to hire for. All right. That's what you need the virtual assistant for, to fill in those gaps for you. So now you know what skills that you need for to hire somebody. The other thing is when you don't have time, I always keep coming back to time. I always keep harping on that, right, Dr. Maryal? Because I mean, that's the one finite resource that, is the same for everybody. There's only 24 hours in a day. It doesn't matter if you're Elon Musk. It doesn't matter if you're Dr. Marion. It doesn't matter if you're me. There's only 24 hours in a day. You can only do so much. So you only have this fixed amount of time to do everything that you need to do. And starting a business is not easy. There's so much that you have to do, and there's only so many hours in a day. And that's especially true if you're also like juggling your current job while trying to start your DPC. That basically cuts your time in half or into a quarter or whatever it is to really get your practice up and running. And so even if you're just starting out, it's very beneficial to hire somebody to get you that help. And the last thing is you don't have the energy to hire, or you don't have the energy to do any of the work. You have the time, but you're burnt out. Really, your health is the most important thing as well. So if you don't have the energy to hire, that's very important. You need to get people to help you out. Everybody thinks they can handle more. I find that to be true for myself as well. We want to take on, because doctors are very responsible individuals. You guys went through medical school, you guys studied, burned the midnight oil, you guys worked 80 hours a week, you guys worked 100 hours a week. So you guys are capable of so much. But sometimes that leads to the burnout, that leads to just overwhelming yourself and taking too much on. And then things start to fall through the gaps, whether it's patient care or whether it's something else. And eventually something starts to fall through the cracks. I always say hire early instead of hiring late. When your plate is at 50%, you should hire somebody already, because that plate stacks up very quickly. Right. And so you always want to make sure you're handing off stuff as quickly as possible, getting help as quickly as possible to really help yourself out, help your practice out, help your patients out.
Yeah, great point. And this is going back to hashtag first world problems when your DPC is growing and you're like, oh my goodness, I now have multiple patients to onboard and I have multiple patients to get records for, or to call CVS for vaccines for, or whatever, I absolutely agree that things just stack up, and then you don't even realize that you're going to get a fire hose pretty soon in a lot of cases. Justin, I will say that the skills that you listed, it might be intimidating for some of the listeners out there, because things like sales and legal and website design, these are things that when we go to medical school, nowhere in our essays do they ask us, like, where are you and your level of being able to do all of these skills that you just mentioned. Now that we've talked about how time is not infinite. We all wish it could be infinite sometimes, but definitely when you're looking for how to maintain a service business that is going to have quick response time, quality customer service, and all of the physician entrepreneur hats that we wear, it is so important to keep in mind that if you are struggling for your own time management, if your DPC is encroaching on your time that you're spending with family, things that you didn't like. I really like how you said, when you're 50% full, think about hiring before the plate stacked too high. If you're saying, hey, I can do things like QuickBooks, but it does not bring me joy. If the energy that you're experiencing after doing all of these tasks in your DPC is draining, then the next question comes. And like we talked about in the very beginning, the next question is really, how do you go about hiring someone to help? So tell us about how one goes about hiring a virtual assistant, especially by partnering with Coolblue VA.
Absolutely. So yeah, we'll go through some best practices for hiring staff. Number one, you want to write a clear job description of what you expect for your virtual assistant to do or for your staff to do. So we're going to have clear, defined responsibilities, expectations, what tools you're going to use, and what the outcomes that you expect are. And that leads us into our third exercise. And once again, spoiler alert, if you don't want to do any of these exercises, I'll just tell you right now, you can give us a call and we'll do it for you for free. So if you don't want to do the exercise, that's absolutely fine. But I find it's just beneficial to kind of work through it so you understand what you're getting into, what you need, and what your business really needs, right? And Dr. Maryal mentioned earlier, these are good things to do on an ongoing basis, really to kind of get a pulse, get a check on the health of your practice and how you're doing and how you feel like your practice is doing. So these are great things to do on an ongoing basis, right? Now, we've already identified in first exercise things that take up the most time and what tasks as a result you should be delegating because they take up so much time. And then in our second exercise, we already identified what skills that you lack or you need support with, right? So all of that, then you can turn into basically your job description and what you want to hire for. So what's the job title that you have, what you need help with, right? What kind of support do you need? That's the first thing you want to write down. And the second thing is the summary of the role based on the top three tasks, top five tasks you circle for delegation. What's the main goal for this person? All right. And also another tool, like you could put all this into ChatGPT as well, and they'll spit out a great job description for you as well. And those get you something really solid as well. So AI is amazing to help you out too, right? Key responsibilities is the next thing that you want to do. So once again, from your delegation list that you wrote down, exercise one, write down what the expectations are and what you're going to be doing. Next thing you want to have is required tools and software, right? What you're going to be using, whether you're using Jane or Hint or you're on what phone service you're using, make sure that they know what you're using so that they can be trained in those tasks, or if they're familiar with it, even better. All right. So what are the skills that they need and what are the qualifications that they need? That's the next thing that you want to do. What kind of traits or experience would make someone thrive in this role? So for example, they're very detail oriented, or they need to know medical terminology if they're going to be a scribe, right? Or they can be fluent in English, or if you need them to speak Spanish, I mean, your Spanish speaking community, those are things that you want to write down. And then what are the hours that they're going to be working? Monday to Friday, 8 to 12, 1 to 5. What's going to be going on as far as that goes? How should they report to you and what the expectations are for their job as well. The more you delineate and have clear expectations, the more you're going to be easier to work together with the person that you do hire, right? So, and once again, if you don't want to do any of that, like I said, just give us a call at Kulu VA and we'll be happy to help you out with all of those exercises. We do a free practice analysis that basically is about 30 minutes. We really dive into your practice, or if you're thinking about starting up a practice, we dive into what all is involved with all of that. We'll go through all those exercises with you and we'll really fine tune and pinpoint what your needs are, what you need help with, and then we can get you the right person for that position of that job. But the next thing that you want to do when you're hiring is to test the candidate. You want to make sure that they're qualified for the job. A lot of people, I hate to say it, they're going to lie on their resume. So you want to make sure you do testing. And actually, I recommend this first test called High Five test. Great test. Actually, everybody should do this test. Doctors should do this test as well here. And I'll go into that in a little bit here. But a typing test, super important, being on an EHR now. You got to make sure that they type well. That's easily available. You can just Google typing test. Super easy to find. Spelling and grammar, actually super important as well, especially with EHR. You want to make sure your notes are written correctly. And having a math test, actually really important as well. If they're handling anything with money, all right, you want to make sure they know how to count. And those are very simple tests that you can do here. The first test, the High Five test, really is an online test that you can do. You can just go to highfivetest.com. They answer you a bunch of questions, and it really identifies the strengths of what you have here. So I pulled up mine just for example. This is a test I did. And you can see I'm a chameleon, I'm a winner, I'm an analyst, brainstormer, and a thinker. So those are my strengths. Those are things that I am good at, right? And you can see that and it breaks down into 4 different areas. So thinking is one skill, doing is one skill, feeling, connecting people, empathizing with them is a skill, and then motivating is a skill. So you can see my strength is a lot in thinking. So I'm a great thinker. My weakness is I don't do stuff well. I don't execute well. So I get virtual assistants to help me execute things that I can't do, right? So what you want to find for your position then is things that they're going to be good to do. If they're going to be like customer service oriented, you want to get people who are like high on feeling, right? So they're going to really connect with the patients. If you want people to do administrative work, you want to get people who are high on doing stuff, right? So that they get joy out of executing, they get joy out of completing, they get joy out of checklists, right? And whatnot. And so having a strengths finder test is hugely beneficial and see to do. Another thing, like I said, testing spelling and grammar. If you're watching the video, there's a sentence online here that has a bunch of spelling and grammar mistakes. And once again, I just pulled this off of ChatGPT. You can sort of just write, hey, give me a sentence that has spelling and grammar errors. And tell me what they are. And you can see and write it down on a piece of paper or just print it out on a piece of paper and give it to your staff and see if they can identify how many mistakes they can. This was actually I'm embarrassed to say I didn't identify every mistake on this thing. But yeah, my grammar is not that great. But that's why you got to hire people that have really good grammar, better grammar than myself, right?
I was going to say that looks like when I'm sending internal portal messages, I'm like, that's pretty frequent. I'm like, wow, totally, that could have been me writing that. Oh my goodness.
Yeah. Yeah. And then, like I said, math tests, super simple. Just put 3 numbers, just put it out. I mean, you can have your calculator out, but they shouldn't have their calculator out and they can do basic math. 3 numbers out, see if they can add it together. So you know that they can count money, right? Which is really important to make sure that you're getting paid. All right. So once again, write a clear job description, make sure you test the candidate, and then make sure you interview thoroughly. For a great place to start, do a virtual interview. If they do well in a virtual interview, then you can bring them in for a physical interview. During an interview, you don't want to be asking like yes or no questions. Those are easy questions.
Mhm.
You want to ask open-ended questions like, what would you do in this scenario? How do you feel about this? Did you have an instance where you got into a disagreement with the patient or anything like that? And then can kind of talk through it and you really see how they have. So asking yes or no questions I mean, it's good questions, but they're kind of just yes, no. It doesn't really bring a lot of flavor out of the personality of the person, right? So asking open-ended questions Very important. And then very important as well, and you want to check with your state on whether you can do this or not, but you want to have a trial period if possible so you can observe them in real life scenarios. Some states require you to pay them for a trial period. Some states say you can have free for a trial period. And so you really want to make sure that you are working with this person and it's going to be a good fit for you guys, right? That's
So
always huge. So those are some best practices for hiring staff.
that's awesome that you guys offer a practice analysis because I think that, again, especially for those people who are newer to DPC, they're planning, they're starting out. I think that a practice analysis can really help because, again, when it comes to skills, you guys are very skilled in pairing a virtual assistant with the doctor. And when it comes to trial period, you guys have probably one of the sweetest deals out there in terms of you and Dr. Carrie Lamb spoke about it on your previous episode, and you still have a way for people to actually do a free trial through Coolblue VA. And so tell us about where people can go to hire a virtual assistant partnering with you guys at Coolblue VA.
If everything I went through sounds great, but it's super overwhelming, don't worry. We run through all of this with our virtual assistants to make sure that you're getting the best candidate possible. We do a trial period with our virtual assistants, and on top of that, we will make sure that you get a trial period with the virtual assistant as well. So we do 2 weeks free where you can work with your virtual assistant. I'll work with you for 40 hours a week, 80 hours in total in 2 weeks to make sure that, it's going to be a good fit for you and that you guys really vibe and gel well together. And that's absolutely free. You can go to, at the end, I'll throw up a QR code that you can go to, but you can go to coolblueva.com/2, that's the number 2 weeks. And that will get you to our landing page, and then you can sign up for a free trial right there.
So as we keep talking, I definitely will say here that I have lived this journey of virtual assistants since before I opened my clinic. And I do think that this is so important, what you're going to talk to us about, because when you're in your opening days, especially, and your budget is tight, to be able to have help when you're not able to do everything from day one. That was my journey. I think it's so important to realistically look at how you can actually afford help on day one. So, Justin, tell us about especially the difference between when you hire somebody virtually versus hiring somebody in person.
It's important to have both areas covered here. I want to present both sides of everything so you guys get a really good feel of what your needs are here. If you're hiring a local medical assistant, according to U.S. Bureau of Labor Statistics now, the average hourly wage for a local medical assistant is about $20.84 an hour. And typically, they're going to have a high school diploma. They may or may not have a medical assistant certificate. And the work experience is going to be really variable depending on what is available in your area, right? Usually, people maybe have 1 year of experience, or they may be fresh out of a high school, or they just got their medical assistant certificate and they're just kind of looking and need experience a lot of times, right? And so with that, there comes a lot of HR headaches and compliance burdens. You have to make sure everything is like OSHA and HIPAA, right? And you never know who you're going to be getting. They may have unreliable work ethic. They have limited qualifications or experience. And it takes a lot of time to onboard staff. And it can be expensive as well, especially if you're going with an agency. Agencies can sometimes take up to 50% of the wages. So instead of paying $20 an hour, you're going to actually end up paying like $30 an hour because the agency is going to take a cut of that. So it can end up being really expensive. And in a recent study from the American Board of Family Medicine, it was actually found out that medical assistants locally had a really high turnover rate of almost 60%. It's 59% in 1 year that they're going to leave your practice. So that's basically money down the drain, right? That you spent training them, working with them, building them up. In terms of hours, that can lead up to about $14,000 that you spent training this MA only for them to leave. So it's very, very disheartening for one thing, but it's also very expensive. Now, that's not to say you shouldn't hire somebody physically, locally, because a local medical assistant can help you. They should focus on tasks and projects that are just necessary for the patient encounter physically and tasks that are going to bring you revenue. And so that's like rooming patients, vitaling patients, accepting payments locally, injections, vaccines, things that generate revenue, procedures, assisting the doctors on procedures, right? These are things that can generate revenue, then they provide value. And then you can afford to pay them the more expensive rates. But everything else should be handed off to a medical virtual assistant because spoiler alert, it's only $9.95 an hour to hire a medical virtual assistant. And for a list of everything that our medical virtual assistant can help you do, we'll be at DPC Summit coming up here. So make sure you stop by our booth. We have a list of over 90 things that our virtual assistant can help you out with. Make sure you grab that and see, or you can check out our website as well and to find out a list of over 90 things that our virtual assistant can help you out with here.
Now, Justin, can you tell us what the difference is between a virtual assistant and a medical virtual assistant?
Virtual assistants, also, the real people, they have a medical degree as well. They can have a medical degree, so they can be nurses, pharmacists, lab techs, really qualified people. And so instead of having a high school degree, they'll have a bachelor's degree at the very least. Very qualified, very well educated, and they will also have excellent work experience as well. When we're interviewing, like I said, we make sure that they have at least 3 to 5 years of work experience, real life experience. So we make sure that they are very qualified to work with you and they're going to be trained in exactly what your practice needs, whether that's customer service, administrative work, scribing, anything that you need. We have our training programs to make sure that they get trained on that as well. And we get our virtual assistants from the Philippines because the Philippines has what is called the Data Privacy Act of 2012, which basically mimics HIPAA and high-tech acts in America. So they're very data privacy forward. They're very secure about that as well. So very important to hire virtual assistants from the Philippines. And just to sum everything up again, a virtual assistant can do everything short of touch a patient: customer service, administrative tasks, medical assisting, marketing and practice growth. Dr. Maryal, like you're saying, if people who are just thinking about starting off with their practice or just open a practice, having that marketing experience, practice growth, executive assistant functions to really lighten your load, that's super important to keep you growing, keep the balls rolling, keep everything in motion. All right. And see. And so if you're not sure where to start or what you need help with, come visit our booth again or come see us. That's why we do the practice analysis. It's really to help you figure out what you need, where to start, how to really get you the help that's going to maximize your time and benefit. And if you don't have the time to train and whatnot, that's why we go through all those best practices for hiring. We do the training, we do the interviewing, we do the testing to make sure that you're going to get a qualified candidate here. And if you're not sure if the medical virtual assistant is the right fit, that's why we give you a 2-week guarantee, a 2-week free trial to make sure that you test it out, see if it's going to be a good fit for you, see if you guys gel well together, see if you guys vibe together, see if it makes sense for your business, for your DPC. So take advantage of our 2-week guarantee, sign up with us, stop by our booth, experience how a VA can really transform your practice, make your life easier, get you home to your kids on time, have you not miss any soccer practices or games or recitals or anything like that. That's really what we want for DPC doctors, right?
Absolutely.
Give us a call, 714-695-8000. Email us, admin@coolblueva.com. Or once again, the website for the 2-week free trial is coolblueva.com/2. That's the number 2 weeks. And we'll be at the DPC Summit supporting the movement. So definitely stop by and say hello. We'd love to talk more
I wish I had a list like that before I started. So definitely make sure that you stop by Cool Blue VA's table and meet Justin in person and grab one of those lists. And then if you're not able to be there in person, make sure that you go to their website so that you can download the list digitally. So that's fantastic that Cool Blue VA exists. I'm so glad that you turned your expertise into something that can help so many other people thrive in their DPC practices. And 80 hours, guys, I mean, that is a ton of work that can be done in a medical practice, especially a DPC practice. And so I highly encourage everyone to check out what can a medical virtual assistant do for your practice. Again, that website is coolblueva.com/2 weeks. Thank you so much, Justin, for joining us today. And I am so excited for everything that you guys are bringing to the fold in DPC through your medical virtual assistants.
Thank you. Yeah, see you guys in person. Stop by the booth. Looking forward to continuing to support this movement. Thank you.
Thank you for listening to another episode of My DPC Story. If you enjoyed it, please leave a 5-star review on your favorite podcast platform. It helps others find the show. Have a question about direct primary care? Leave me a voicemail. You might hear it answered in a future episode. Follow us on socials at the handle @MyDPCStory and join DPC Didactics, our monthly deep dive into your questions and challenges. Links are at mydpcstory.com. For exclusive content you won't hear anywhere else, join our Patreon. Find the link in the show notes or search for My DPC Story on patreon.com. For DPC News on the daily, check out dpcnews.com. Until next week, this is Maryal Concepcion.